Hello, it's Dr. Queen again. This time we want to talk about nasal congestion. That's one of the most common symptoms that we see in the office. And you can break nasal congestion down into two major categories. There are anatomic causes and there are physiologic causes. Now, anatomic causes are structural abnormalities inside of your nose. They're always there, okay? They don't change. The most common cause of anatomic nasal congestion is the deviated nasal septum. That means that the piece of cartilage and bone in the center of your nose is crooked, pushed one side or the other, or sometimes it's twisted and blocking both sides. That causes nasal congestion. Sometimes it can also cause facial or sinus pain. It can lead to nosebleeds on occasion. It can lead to snoring with your mouth open, getting winded when you exercise if you have to mouth breathe, for example. And so anatomic problems are typically surgical problems. You just fix them. Other anatomic causes are enlarged turbinates. Now, turbinates are little bones that come from the side of your nose. And they can either be too large, too much bone, which causes an anatomic obstruction. Sometimes they're just swollen, and that's different. I'm going to come back to that. But large bone in the turbinates, sometimes the opening of the sinuses are just narrow, and it's very easy for them to get obstructed. So anatomic causes we typically will discover basically by looking in your nose, either with my headlight and a nasal speculum, or I may use a nasal endoscope where I'll look up inside of your nose, which doesn't hurt, by the way. It just allows me to see much better on the inside of your nose, and we can see the deviations or the large bones that may be obstructing things. Sometimes we need a CT scan of the sinuses to see what's going on back inside the sinuses, because by looking in your nose, even with a telescope, I can't see behind the bone. So we'll get a CT frequently if there's a lot of sinus issues. Those are your anatomic structural problems, and those are corrected with various forms of surgery. Now, physiologic causes are things that change. Swelling and mucus. Some times of day may be worse. Some days may be worse than others. In this part of the world, in Hampton Roads, Virginia, the most common cause of physiologic nasal congestion by far are allergies, allergic rhinitis, mucus, and swelling inside your nose that causes congestion. There are a few other things that we kind of lump into this, what I call a trash can diagnosis of non-allergic rhinitis, which is kind of everything that looks like allergy but isn't. Some of those may be chemical sensitivities, emotional hormonal levels, temperature changes, tobacco smoke, paint fumes, gasoline fumes, for example, will give you some of the symptoms of allergy, but they're not actually immune reactions as an allergy would be, but they respond to some of the same medications and so forth as well. Treatment for physiologic causes are basically going to be ways to decrease the swelling induced mucus, treating the allergies, for example, with medications or with allergy immunotherapy.